3 vitamins for stronger legs fast. Science-backed senior health tips. Struggling with weak legs, stiffness, or balance issues as you age. Most people assume that this is simply aging. Here is the reality though. In fact, it's one of the earliest indicators of age-related muscle mass or sarcopenia. It all happens in silence, no pain, no swelling, until one day, you need help just to get out of a chair. You're not alone. But here's the good news, science shows that 3 key vitamins can help rebuild strength, support nerve function, and improve circulation in your lower body. No strenuous exercise, no costly therapy, the ideal nutrients at the ideal moment. Let's break down exactly what they are, how they work, and how to use them for stronger legs, fast. This isn't health gossip or hearsay. Clinical investigations, actual research, and decades of professional experience support it. Stay with me through to the very finish. Whether you're walking upstairs, getting out of a chair, or just hoping to stay independent, leg strength is essential. The majority of individuals are unaware that the legs typically experience initial weakness, making even simple tasks like standing up or walking difficult. Even if they're eating well and feeling fine, adults over 60 lose between 1 to 3% of their muscle mass every year, according to the American Geriatric Society. Today, we'll explore 3 essential vitamins that support muscle repair, nerve health, and blood flow, all backed by research and practical tips to add them to your routine. Number 1, Vitamin D, the muscle repair powerhouse. Vitamin D isn't just for bones, it plays a critical role in muscle protein synthesis, helping you recover faster and build stronger muscle fibers. Low vitamin D has been directly linked to reduced lower body strength and falls in older adults. How to get it? Natural sources, sunlight, fatty fish, like salmon, egg yolks, fortified dairy. Supplement form, look for D3, cholecalciferol, usually 800 to 2000 IU daily for seniors, depending on your blood levels. Always check with your doctor. Quick tip, take it with a meal containing fat. Vitamin D is fat-soluble and needs fat to absorb properly. Vitamin number 2, B12, for nerves and muscle activation. Vitamin B12 supports nerve conduction, helping your brain communicate with your muscles effectively. Deficiency in B12 can lead to numbness, tingling, and weakness in the legs, especially common in seniors due to reduced absorption with age. How to get it? Food sources, meat, fish, dairy, fortified cereals. Supplement form, if you're over 60, you may need sublingual tablets or B12 injections. Aim for at least 500 to 1000 micrograms daily if supplementing. Bonus, B12 also supports red blood cell production, helping deliver oxygen to working muscles. Vitamin number 3, Vitamin E, for blood flow and endurance. Vitamin E is a powerful antioxidant that improves circulation and reduces oxidative stress in muscles. Better circulation means more oxygen and nutrients reach your legs, helping with endurance and recovery. How to get it? Food sources, almonds, sunflower seeds, spinach, avocados. Supplement form, look for mixed tocopherols, not just alpha-tocopherol. Around 100 to 200 IU daily is typically safe. Pro tip, combine with vitamin C or CoQ10 to enhance antioxidant benefits. How to combine these vitamins for maximum effect? Here's how to stack them smartly. Take vitamin D with breakfast, ideally alongside healthy fats like eggs or avocado toast. Use B12 mid-morning or sublingual, especially if you have digestion issues. Take vitamin E with your main meal to aid absorption. And don't forget, hydration and light exercise, like walking or resistance bands, help your body use these nutrients more efficiently. Stay strong, stay independent. You don't need extreme workouts or expensive equipment to strengthen your legs. By supporting your body with the right nutrients, you're giving your muscles, nerves, and blood flow exactly what they need to rebuild and perform. Before starting any supplement, talk with your healthcare provider, especially if you're on medication. But remember, it's never too late to get stronger. If this video helped, don't forget to like, subscribe, and share it with someone who needs stronger legs today. Drop a comment if you want a follow-up video on exercises or meal plans that go with these vitamins.